I think about like the average practice and bandwidth that a practice manager might have, or a billing manager might have, or limited bandwidth, I guess is probably a better way to think about it. How hard is it for any kind of average practice to stay on top of all of the changing coding requirements, new modifiers, like everything that goes on in your world that Svast are experts on? How difficult is it for your average practice of any size to kind of stay up on all those things?
Well, I think it's almost impossible. I mean, I think in most, especially in today's day and age, things are changing almost weekly with the carriers. We saw that fiercely throughout COVID, right? I mean, they had put out the processes and the specifics for coding throughout COVID, but that was changing weekly. Place of service codes were changing, and codes in themselves, CPT codes were changing, diagnosis requirements were changing. So it's almost impossible to learn on the fly like that and still maintain that level of patient care. And that's really what we want to do. We want to be able to allow the practice to keep that level of customer service at an all-time high at the front, for the physicians and the providers to focus on their patients in the back in the clinic, and allow Svast or whomever's handling their billing to be able to provide that expertise for their day-to-day RCM services.